Gastroesophageal reflux disease is a condition in which acid refluxes into the esophagus from the stomach, and it also contains gastric parts like food particles as well, and it causes troublesome or complications to the patient like gastric erosions, esophageal erosions, esophagitis, Barrett's esophagus, Goel syndrome. This retrograde flow of gastric contents occur into the esophagus, oropharynx, and or respiratory tract. So sometimes refluxes causes cough and cough. The patients who is having cough for 3 months, it may be the gastroesophageal reflux disease. There is no necessity of tuberculosis. If patient has no weight loss, no sweating, no lassitude, or evening rise mild fever. The Monterial definition of GERD states that troublesome lymphoma symptoms may be considered to be moderate to severe symptoms that occur 1 or more days per week. GERD symptoms without erosions on endoscopic examination constitute non-erosive reflux disease. If there is no erosions, it means non-erosive reflux disease, and it is seen in upper GI endoscopy. So, GERD symptoms with erosions constitute erosive esophagitis. Erosive esophagitis may cause malaria due to the bleeding. Non-esophageal reflux disease has been defined especially as a subcategory of GERD characterized by troublesome reflux-related symptoms in the absence of esophageal mucosal erosions at conventional endoscopy and in the absence of recent acid-suppressive therapy. NERD is by far the most common form of GERD. NERD means non-erosive reflux disease. Now, gastroesophageal reflux disease is a sensory motor disorder associated with impairment of the normal anti-reflux mechanisms. How anti-reflux mechanism works? It is due to the angulation of esophagus to the stomach. Second is due to the sphincter. Third is the phrenicoesophageal ligament. And 3 things when mixed, and it causes anti-reflux mechanism. When any one of them will destroy, then it causes gastroesophageal reflux disease. Sometimes pathological causes may cause reflux disease like Joling-Wilson syndrome, impaired esophageal peristalsis, increased intragastric pressure, increased intra-abdominal pressure, like that. So obesity is also a cause of reflux disease. Increased intake of food, over intake of food may cause reflux disease. So eating and lifestyles involve gastroesophageal reflux disease, like high body mass intake or the index of obesity, high dietary fat intake, carbonated drinks like Coca-Cola, Pepsi, Sprite, caffeine, alcohol, smoking, spicy food. So some medications which causes reflux disease like NSAIDs. NSAIDs like जैसे हम लोग पैरासिटामोल खाते हैं, डाइक्लोफेनाक, एसिक्लोफेनाक लेते हैं, पैरोक्सिकाम लेते हैं, इन सब कैल्शियम चैनल ब्लॉकर्स जो एंटी हाइपरटेंसिव में हम लोग यूज करते हैं, एंटीकोलिनर्जिक्स जो हम लोग एंटी डिप्रेसेंट्स में यूज करते हैं, बिस्फोसफोनेट्स, antibiotics and potassium supplements. Pregnancy also causes reflux diseases. Other factors like comorbidities like diabetes, metabolic syndrome, cardiovascular disease, and sleep apnea. Overweight and obesity already I have explained, but frequently coexists with other GI symptoms such as irritable bowel syndrome. Irritable bowel syndrome is very common in young people who remains always in excess condition. And fourth is osteoporosis. So what are the symptoms of gastroesophageal reflux? Symptoms: first is heartburn, regurgitation, water burst, that means hypersalivation. बहुत ज़्यादा भूख आता है, बहुत ज़्यादा लार आता है. Atypical symptoms like chest pain, that is retroesternal pain, it is also called pyrosis, bloating, vomiting, respiratory symptoms like cough, wheeze, chronic sinusitis, ENT symptoms, hoarseness, pharyngeal pain, nausea, belching. So, how do you diagnose the gastroesophageal reflux disease? The presence of heartburn and/or regurgitation symptoms 2 or more times a week, suggestive of gastroesophageal reflux disease. Clinical endoscopic and pH metric criteria provide a comprehensive explanation of the disease, although investigations are usually not required in order to establish a diagnosis of GERD. So, patient history, including personal, family diet, drug, and such problems like asthma, cardiac diseases, cancer. So diagnostic options include empirical PPI trial, urea breath test for H. pylori, stool AG test, upper GI endoscopy, pH or impedance pH monitoring, and endoscopic biopsy. So what are the management options? So first is lifestyle modification. I've already explained obesity is most common cause, so diets and weight loss is very necessary. Symptomatic home remedies, antacids, H2 blockers, TTI for 8 to 12 weeks. Surgical intervention is required in case of failure of other interventions to coexisting with it. So patients should maintain your lifestyle. You have to modify your lifestyle. Like eliminated premium foods and drinks. Regular sleep time meals. मतलब आप ऐसा नहीं, हमारे देश की महिलाएं ऐसे कि सुबह में उठी और उठ करके पूजा पाठ करके 5 बजे से उठी और 10 से 11 बजे खा रही. It also causes gastroesophageal disease. So regular sleep time meals is very necessary. Weight loss, obesity is also a common cause. So weight loss is important. A man always takes goes for cigarette smoking. Cigarette smoking is also necessary. So stop cigarette smoking. No pressure on the stomach. Overall intake should be reduced. Sleeping in chair, inclined sleeping position. So all of them are causes. So you have to sleep in the left recumbent position. It is very necessary after taking meal, or you have to go for a walk after taking meal for night, and then go to bed. And always sleep in the left recumbent position, not in inclined sleeping position. So these are the conditions you should know about the gastroesophageal reflux disease, which is very common in our state or in our world. So you can correct it by modifying your lifestyles and drugs. So okay, thank you.